Actually, that's a great question because I think we offer a lot. And because you have to remember that cancer is not just something like an infection. This is going to be an in-depth relationship that the patient and I are going to have hopefully for years, hopefully for a long time. But to get them hopefully to cure, or at least for long-term remission, they go through a lot. So not only do we offer the medical services, we have a nutritionist, we have a social worker. Number one, to get through the bureaucracy of trying to get whatever they can get to help them out, financially, and also for mental health. So we offer nutritional services, social services, we have mid-level provider support, and we have a network of doctors that are throughout all of Atlanta, from up Blairsville down all the way down to Macon, all connected by the internet. That's a great question because a lot of people have misconceptions about cancer chemotherapy. When I was training, a lot of chemotherapy had to be given in the hospital and it required overnight stays. We've become a lot more sophisticated. Most chemotherapy is actually given as an outpatient. So they would come to the office, get therapy, and go home. Basically, we want to keep you having a normal, active, as much as a quality of life as we can. There are certain types of therapies that necessitate us bring you into hospital, and then usually for here, we would bring someone over to Cobb. If there is a need for like radiation, for instance, we would coordinate that with the group over either radiation or over at Kennestone, because this kind of branches both ways depending upon where in Portland County they live. That they also would usually do as an outpatient. If they have to be admitted, the services that WellStar would provide essentially would be the nutritionist, the dietitian, the pharmacy, the social services also. So once again, there's a continuum from what we can provide as our own private practice to what WellStar provides as a healthcare community. First, I want to say thank you. I'm basically honored to be here. I had been toying with the idea of coming out to Paulding for a couple of years prior to me actually doing it. And it's kind of a big leap just to open up your outreach office. And I was nervous. I was the first oncologist to come out here. It's a new area. I was very comfortable at my home base at Cobb. I started over in October and in the old building, and was immediately greeted with people who were thankful that someone is actually coming out to them. And that's the whole goal of Georgia Cancer, is that we want to bring, sophisticated, up-to-date quality of care to the community instead of having everyone go to Atlanta. And what I really found was that the people here are a pleasure. It is such a pleasure coming to the office. I come here every Monday, and it is such a nice beginning of the week. I've met so many people here. They're friendly, kind, and it's a fun office to work in. The people are down to earth, and I've really gotten to know them really well. So for me as a practitioner, I enjoy starting my week at this office and in this community.